Hi, I'm DeQuincy, and we're going to be watching the fifth drill in a series that focuses on glove application. As a trainer, I want to remind you that the end objective that we're striving for is that if our lifeguards have to respond to an emergency, application of the gloves will not interfere or delay in the delivery of good patient care. Since we're at the fifth drill, we've already covered glove application with gloves in hand, glove application with gloves being pulled from a hip pack, glove application with a running distance or an endpoint that you want your lifeguards to go to, and the fourth one, which was glove application, gloves being pulled from the hip pack, doubling the distance. Alright, in this one we're going to focus on the guards running roughly about 75 yards to a victim and placing themselves around the victim in about 12 seconds. Let's go ahead and watch the drill and come back and do a breakdown for the benefit of all those new lifeguard instructors and in-service trainers. Here we go.
This is what I need you to do. I need you to get to the victim and put yourself in a proper position to give care. One of you will get at the airway to manage the airway. One of you will use the BVM, so you'll be supporting the airway. And the last person will actually be in position to give chest compressions. All right? You need to have your gloves on for this. You're going to have 12 seconds. Are you ready? Get set. Go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. That's a pass.
Alright, nice. So we just watched the drill. Let's take a look at what works and what can be improved upon. Alright, first thing that I see here is the placement of the hip packs on all the rescuers. One's at the side, another at the side, and one at the front. Again, ideally you want your guards to either have their hip packs all on the side or on the rear of them and be able to confidently reach down, open up the pack without looking at it. Alright, let's keep going here. Alright. Hold, let's back this up because I did want to make a comment. Look here and look here. Both rescuers have their hands on their hip packs with their hand on the zipper. Again, I'm okay with that right now. Ultimately, your lifeguards aren't going to be making the rotations or scanning or guarding with one hand always on their hip pack. So we want to train that out of them and get them comfortable and proficient so they don't have to rely on this type of maneuver. Alright, let's keep going. Okay. Again, we're setting up the distance that they're going to run here. Let's get all the way over there. Again, 25 yards roughly. And again, they're going to be covering this in 10 to 12 seconds. I've given them 12. Again, the sweet spot as a trainer is going to be between 10 to 12. So let's go ahead and take a look here. Alright. The distance is established. They're running right now. This looks okay. I would say here you can see it with forward and also here. If you take a look, both lifeguards are looking down at their hands while they're running. And again, a concern that I would have is can they achieve the objective without having to visually commit themselves to look at their hands and see what they're doing. Again, that's what we want to strive for. No eye contact with their hands and what they're doing. They've developed that muscle memory. Alright. So, they've positioned themselves good. We've got one at the top of the head, one at the side to support airway management, and one that's moving into the chest. I'd say overall this looks good. They're getting their gloves on. No problems, no problems. If I wanted to make a comment right now, I would say here, in regards to the victim, no one is addressing the victim's concerns, opening up the airway. Alright, so one, they can either practice to get their gloves on a little bit faster, or at least one person who's going to be at the top of the head to open up the airway, have their gloves on. Or two, what you can do is make the decision that at least one person gets there, opens up the airway, then as another person arrives with gloves on, they transition out, and the person that was initially there then has the time to put their gloves on. So you could possibly do that, but then again, that's going to be a lot more practice. Alright, let's take a look here. So, when they get in position, opens up the airway, that looks good. Checks for a pulse, I like that. Gloves are coming on. Again, this is time sensitive. Boom, and they got there. And that works for me. Alright, so thanks for watching, and I'll talk to you later.